I'm really familiar with those. Oh, no. Right.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Leon. Happy birthday to you.
All right. With that, I will call to order the Champaign County Mental Health Board meeting May 24th, 2023. We do have a board member who is ill and cannot come to the meeting in person, so I will move for a motion to allow her to attend virtually. Do I need a roll call or?
No, I think so.
Yeah. Yeah, so we'll get a roll call. Yeah. Oh, it'll be for Daphne Maurer to attend virtually. Can I get a roll call?
Yes.
Oh, sorry, I got a second. Thank you. Can I get a roll call, please?
Yes.
Oh,
Yes.
we don't have audio. She says yes.
Mhm.
Thank you, Jeff.
Yes.
Yes.
Yes. Yes. Yes.
Yes. All right. With that, we'll move on to approval of the agenda. Do I have a motion to approve the agenda?
I move to approve the agenda.
With that, do I have a second?
Oh, let me show the agenda.
Yes.
I'll second.
Can I get a roll call, please?
Yes. Yes. Yes.
Yes.
Yes. Yes.
Yes.
Yes. With that, we'll move to citizen input. All are welcome to attend the board meeting to observe and offer thoughts during this time. We'll limit public participation to 5 minutes per person with a total of 20 minutes total. Is there anyone in the audience that would like to make comments? So I see Claudia, you can state your name and agency for the board or for the record.
My name is Claudia.
Good evening. My name is Claudia Lenhoff, and I'm the Executive Director of Champaign County Healthcare Consumers. And I just wanted to make some announcements about some of the services that we have available in case, there's people paying attention to this meeting. So one of the services that we have available is that we help people apply for disability, SSI and SSDI. And and we actually have really strong staff capacity right now, thanks in large part to the Mental Health Board, We have a full-time staff member who is just dedicated to that. We got some other grant funding that allowed us to hire another person, and our staff are working through applications really, really well. And we work with people at their own pace. So I just wanted to mention that. Then I also wanted to mention about resources for low-income seniors, because we know that a lot of low-income seniors are really under-enrolled in programs that can help them financially and that can help provide some stability for them. This also applies for people with disabilities who have Medicare as well. One of the programs is Medicare Savings, which can help people with their monthly Medicare premiums, deductibles, and co-insurance costs. And seniors can save over $5,300 per year in Medicare-related out-of-pocket expenses with that program. People need to have income, a single individual needs to have an income below about $1,640 to qualify for that. There is also Medicare Extra Help, which is a program to help with the cost of Medicare Part D prescription drug coverage and copays for prescriptions. This program can reduce the monthly prescription plan premiums as well as get rid of deductibles for people, and can also help with the cost of actual prescriptions out of pocket, and can help people save over $2,000 a year. And income qualifications for that are under $2,000 a month. Then there's also SNAP, which is food stamps, which a lot of people know about, but a lot of seniors do not realize that they can qualify for that. And that can help a low-income senior save up to about $9,000 a year, and with a maximum monthly benefit of about $281 for people who are age 60 and older. So these programs combined, if somebody qualifies for those, can save a person over $16,000 a year and can help provide more financial stability, food security, access to medications, and so on. So people can just contact our organization if they need help with that. And our phone number is 217-352-6533. So I just wanted to let people know about that, and we're happy to receive referrals. Thank you.
Excellent. Thank you very much. Does anyone else want to make a comment? No?
So we have people on the Zoom, if they want to.
Because this is public participation, if there are people on the Zoom, you can hear us, but we can't hear you. So if you would like to make a comment at this time, put it in the chat and I will read it.
All right. While we're waiting for that, we can move on to my comments. So obviously today we're here to discuss the funding requests for PY24. So this has probably been one of the most difficult year that we've had since I've been on the board. Obviously the pandemic was very trying for a lot of agencies and for staff and for a lot of people in the community. This year, with the costs going up for agencies, for the inability or the difficulty in finding staff to fill vacancies and to afford continuing services has been a real trying time for a lot of agencies, and obviously the reduce in funding and trying to find funding for a lot of trying to find funding for a lot of trying to continue finding funding to continue the programs for the agencies has been really trying for a lot of the agencies. So obviously this year we're gonna be funding a lot of programs that lost funding, or this is new funding for them because they lost funding from other places. So with that, I'll move on to Lynn's comments. Or were there anyone else that wanted to make a comment from the agencies before?
We can hear them now, and I don't see any. Okay. Thank you. I have sort of an odd blend of comments, and I'll try to go through them quickly. I wrote them down. Make sure to turn your mic off if you're not speaking into it. If it's got red, it's on. And the reason is the quality of the recording. Applause for our support.
We have someone on the Zoom call try to speak.
Oh, okay. All right. We would like to test this and see if someone on the Zoom call could speak and we could hear them. I would love it if it was Dr. Maurer, because it'd be great to be able to hear her during these motions. Do you mind speaking?
Hello, I'm here. It looks like a good sign.
That's amazing. Thank you so much.
No problem.
Okay. That is amazing. All right. So my first comment was be sure to turn the mics off when you're not talking. It just helps the recording to be more clear. I got permission from the county executive this morning to go ahead and announce that the county board last week appointed a new member to the mental health board, and it's Dr. Lisa Liggins Chambers. I talked to her informally. She hadn't been formally notified yet, but found out about it because she knows how to use the internet. And so I said, well, you can sure come to the meeting if you want, because I think the appointment is effective immediately. But she had an obligation out of town this evening, so she's not here, but we'll meet her next month. And hopefully I can give a formal notice and congratulations between now and then, if I remember. So, okay, that was also, like, just to folks on the Zoom meeting, I am so glad that we can now hear you. I just want to make sure that we do not fail to include Dr. Maurer, since the board has voted her into the meeting as a full participant. So I will try to keep my eye on it, but other folks wait until the board chair says it's okay to talk. That's okay. So that's that. All right, now here's the big stuff. As always, I found an error in the decision memo. It's on page 30. So there's a motion that it refers to, it's the Don Moyer Boys and Girls Club Youth and Family Services motion, but it refers to a different program. Apologies. And I'm working on a draft, like a final draft that captures all of your decisions tonight and any changes you might make to these recommendations. So I can put that on the screen later when we get to it so that you'll see the correct motion. Along those lines, Matt Hausman helpfully identified an issue with some of the motions. So you two have communicated about modifying the motions for denial or deferral so that they're actually clear. There's some extra language that doesn't make sense. Thank you so much. And that is also included in the memo that I can show as we go through the meeting. But the really big news is that I want to present y'all with initial budgets next month. It is way ahead of everybody else doing budgets, but so the numbers I'm working with are the numbers that I got back in April. But I noticed that there's a line where the county has traditionally charged us for the use of the accounting system software. And then I noticed that Chris was telling me to put the same amount in a different line to pay for software. And then we talked and it turned out it was the same software. So that's $13,000 that I had in two different places of the budget. So $13,000 is available right now with no adjustment to any revenue projections. So there's $13,000 available. And then I also noticed that for the first time in many years, we're getting some healthy interest income. And that was something that hadn't been recorded until May. And I could see, there's probably about 20,000 there. So the number that I feel is safe to add to our calculations is 33,443. And there are two recommendations that I would really like to change because of things I've learned subsequent to your meeting last week. Those were, first of all, the first one is that Don Moyer Boys and Girls Club Youth and Family Services Program. They told us they didn't have other funding for the first time in a few years and would be seeking it. So that lower amount was based on like the cost of staff turnover and the possibility of them getting additional funding. But that program is really important to families and children in Rantoul. And so I was thinking, well, we're kind of damning them to have that turnover cost. So I would I would like to change my recommendation to full funding for that contract. And then I also learned that I was wrong about what adult redeploy can pay for. So I wanted to change, I think I did change the language for family services counseling and Rosecrans specialty courts to seek funding through that, because it is not an eligible use of adult redeploy Illinois funding. Therefore, there isn't any other funding on the horizon that could be used for the specialty courts. And the difference between the recommendation that from last week and the amount they requested is mental health court. So I'm also going to recommend full funding for that request so that we can start off mental health court and hope that there does become other funding available for it. Also, so that's what's safe to do within the set of recommendations that you've already talked about for hours and hours and helpfully talked to me about separately. Tomorrow, the United Way is going to make a number of funding decisions that could affect some of the programs you're looking at. And then the county board will also be making some funding decisions about reallocating ARPA funds that are being returned to them, partly from us. So as we get these late audits and we figure out how much money is owed back, it goes back to the county and they can reallocate it. So there are two things that could happen before we even know about increased revenue projections that might change the picture for some agencies. So you might, we've already talked about deferring a couple of these recommendations till later, or deferring a couple of decisions until later. We might also, just like a little broader sweep, like depending on how much money is available, if you want to reconsider other allocation awards that you make today, we could open it up. So it's just a lot is changing. And I don't think that, unfortunately, I don't think that the fact of federal and state funding disappearing before our eyes is going to change this year or next year. So it's probably appropriate for us to have this kind of like a little bit more complicated allocation process this year. And as much extra work as it could be for everyone, it might be the best thing to do with your funds. Anyway, I got to stop talking so you can get on with the business. All right.
Can I ask a question? So you said that the county board might be looking at some ARPA funds that, we have kind of helped return. Is one of the options to kind of like earmark that money to go back to the mental health board? No, so it cannot go back to anything that we are already doing. Okay, thank you.
At least that's not on the table right now. I don't think it's a large amount of money. So I think, and John Straub, you might be in the know here.
So all money that has been allocated that doesn't get spent comes back to us and then we reallocate it. So that being said, we've kind of earmarked certain big amounts of money for different categories like preventing community violence, water projects, all of that stuff. So yes and no, like since we are in a very specific category, our asks may be more considered, but it's not earmarked to go back to us.
All right. With that, we'll move on to the approval of the board meeting minutes on pages 3 through 7. If there's any corrections, just point them out. I do have one on page 6. My first name is John, but Jon, sorry, not John. It was spelled the way everyone else spells it, but not a big deal.
If there are no other changes to the minutes from 4:19 and 4:26, I make a motion to approve them.
All right, and I'll second the motion. Can I have a roll call, please?
Molly McClay,
Yes.
Joe Omosage,
Yes.
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 I don't think we can hear you, Daphne.
Okay, I can't hear my name called. Yes.
Yes.
If you don't mind keeping the mic on when you do that, because the closed caption is just saying yes, 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 without the information of the name.
Okay, I thought it was on.
I know, it couldn't hear you. Yeah.
I think maybe every time we turn our mics on, it might turn yours off. So you might have to keep clicking it on. I don't know.
No, you have
Alright.
to, you do have to control.
All right, with that, we'll move on to the vendor invoice list on pages 8 through 14. I'll let everyone take a few minutes to look at that, and then we can move for a motion after. The only question I had was on page 13. What's the Visa card member service for like $3,995?
Is that what it's?
Yeah, just the state. So wasn't sure what that meant.
That's probably, that looks like the cost of conference. I attended a conference, but I think also Chandra attended a conference, and you're right, like that's, we can't understand the specifics of the Visa bill from this report. And we talked about that a while ago, like when we prepared this, like, what are we going to do if you want to know what a line is? So I can check, but it will take a minute, but okay. And I know Chris is not, let me just ask Chris, or maybe I could ask Chandra. I think Chandra is on the Zoom meeting and maybe she could help us.
Yeah, I'm here.
Is that the charge related to your conference?
Is
39?
it on the screen?
Yeah, it's on the screen. It just says state.
It was in April 11th.
No.
April 11. What in the
Yeah,
heck?
because the charges from my conference would have been in May.
Okay. It's going to take me a while to find it on Munis, so we could come back to the vendor list at the end of the meeting. Okay.
So we'll move on to the new business. First part is the mental health boards.
We need a motion.
Oh, sorry.
Claims and a vote.
No, we can't, because I
Can we
don't the
have a,
information.
do we need a motion to move on to the next item? And,
Well,
and bring and come back to it, a defer a decision or,
These bills have already been paid.
yeah. Okay, I mean, if everyone's fine approving it, that's fine, and then we can just have you look into it and send us an email later with the information on
I
that.
might be able to find it tonight. It's just, the online accounting system is very complex, and if I can log in and look for it, but it's going to really take a minute. So,
I mean, I think if you just send us an email with explanation, I think that's
Okay.
fine. Yeah, I don't have any concerns, so.
okay. I will do that if that's all right with folks. All right.
So with that, do I have a motion to approve the vendor invoice list?
I make a motion to approve the vendor invoice list as presented.
I
Kevin.
second that.
All right, can I have a roll call, please?
Joe Omosagie,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
John Paul Yuki.
Yes. All right, with that, we'll move on to the Mental Health Board PY24 funding requests on page 15 and 16. You can see the total lists. I know we've looked at this a lot already, so If there aren't any questions, we can move on to the staff recommendations on pages 17 through 46.
So if you don't mind, I would like to show you the memo with some updates based on what I discovered, and then I can keep track of your actual of your actual actions while we go, if that's okay. Closed captions cover.
So it looks like the beginning of the motions are going to be on pages 21.
So what I wanted to.
So the first set of changes I would make, like on the internal document, the document has internal page numbers too, and that would be on page 5. I added in the extra money that I found. I mean, that sounds very weird, but I explained where it came from. So I added in those amounts here. So you can see, even though we have been dealing with this, painful shortfall from requests, this is a pretty big jump from what you were able to spend on contracts last year. 264,780 is the affordable. That's more than PY21 awards. So that's a nice big jump anyway. All right. So then we get to the first is regarding contract negotiations. Top of internal page 6. Okay.
And then we can.
Okay.
talk about moving for a motion.
This is standard. Like this allows me with the staff support and expertise to talk to agencies about the contracts, because there are so many recommendations that are different from the awards. We will have to have some kind of conversation, and that might be an email or or a phone call or a Zoom meeting to say, like, if the decreased amount is going to affect utilization targets, which we would expect that there might be some changes needed before the contract. That's usually the nature of the contract negotiations. There are also, we're trying to include in the right above the decisions for you to make a list of the things that we would expect prior to the contract, and then special provisions. So that's kind of like telling you some other negotiation points. If an agency were to reject any of those, then we might come back to you and say it was a failed contract negotiation. What would you like us to do next? So we're trying to put that information in the document so that the contract negotiation is not mysterious. Okay.
Thanks, Lynn. All right. Are there any questions about this? All right. With that, I will move to authorize the executive director to conduct contract negotiations as specified in the memorandum. Do I have a second?
I'll second.
Any discussion? All right. Can I have a roll call, please?
Elaine Palencia,
Yes.
Jen Stroud,
Yes.
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 Daphne Maurer?
Yes.
yes. Joe Omosage,
Yes.
John Paul Yoking.
Yes. All right. With that, we'll move on to the second motion.
I think that was a terrible description last week when I called this the doomsday provision. It's terrible, but that is what it is. I mean, there are all kinds of reasons that we could be looking at lower projected revenues than we're talking about right now. It hasn't happened in a really long time, but just in case. So this is, just sort of an additional warning in the contract.
All right, any questions? All right, seeing none, do I have a motion? Do I have anyone to approve the motion? All right.
I move to authorize the executive director to implement contract maximum reductions as described in this memorandum.
All right, do I have a second?
Second.
All right, Molly, second. Any discussion? All right, can I have a roll call, please?
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
John Paul Yoking.
Yes. All right, with that, we'll move on to the third motion.
So this is also just strengthening the contract language. It's actually also in the funding guidelines that the contract supersedes the funding guidelines. And the most relevant example of it is actually this audit cost issue. So we thought, why not just put that in there? So anyway, and it's similar to the one you adopted last year. The language is tweaked a little bit, but the content is the same.
All right, with that, do I have any motion, anyone to approve the motion? All right,
Motion to include in all contracts the provision referencing specific exceptions to funding requirements and guidelines as described in this memorandum.
I'll second.
all right, can I have or any discussion? Seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandal,
Yes.
John Paul Yoking.
Yes. All right, with that, we will move on to staff recommendations for agency allocations. The first being the CCRPC Community Services Youth Assessment Center. The request was for $76,350, which is 18% of the program revenue. This fits into the priority of safety and crisis stabilization, required prior to contract, revised utilization measures in the plan narrative, and then there's all the special provisions. And the recommendation was to fund at requested annual level and offer a 2-year term. You can see the motion below. I know last week we discussed this and agreed on approving the funding, full funding for this. Was there any questions? With that, do I have a motion to approve?
Yes, I will move to approve the CCMHB funding of $76,350 per year and offer a 2-year term as recommended for CCRPC Community Services Youth Assessment Center, subject to the caveats as presented in this memorandum.
Do I have a
I'll
second?
second that motion.
All right, Daphne seconds. Is there any discussion? Seeing none, can I move to a roll call, please?
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Yoking.
Yes. With that, the next agency program is the Chris Healthy Aging, Improving Family Caregiver Mental Health. It was a new program request for $125,000, which is 45% of the total program revenue. The priority it fills is closing the gaps in access and care. The required prior to contract and during the term was to revise financial forms and for consistency and accuracy, consider revising program plan to focus on paid and unpaid caregivers of people who have intellectual and developmental disabilities with and without dementia, and to present it to the CCDDB and MHB for funding through the IDD special initiatives. The recommendation by staff was to not fund through MHB fund due to affordability and defer for consideration. for intellectual and developmental disability special initiatives funding pending revisions, because the funding is under joint authority of the MHB and DDB board. Approval by both is required. The CCDDB approved a motion to defer for later consideration. So I know we wanted to change the wording on this a little.
Well, this one doesn't have the problematic.
Okay.
Happily.
So yeah, I'll move to deny CCMHB funding as recommended for Chris, Healthy Aging, Improving Family Caregiver, MH, deferring for later consideration of funding through the IDD Special Initiatives Fund with programmatic revisions to focus on IDD and pending approval by CCDDB.
And I will second the motion. Do I need discussion? Seeing none, can I have a roll call, please?
Deny. Oh, no.
So it's a motion to deny, so we say yes, right? Yeah.
Yeah. Okay. Yeah.
Yes. Yes.
Yes.
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
John Paul Joachim,
Yes, all right, so to the motion to deny has passed, and then we'll move on to this next program, which is the CU at Home Shelter Case Management Program. The request was for $403,564, which is 75% of the program revenue. The priorities for crisis stabilization, the required prior to contract during the term is select PY24 priority and rework targets, scope of services and budget forms, revised forms for adjusted award amount, and letter of engagement with a CPA firm for the PY23 audit. There are special provisions as well listed below. The recommendation by staff was to fund at the PY23 award level, which was $256,700. Any questions? All right, seeing none, do I have a motion to approve the funding? I'll move to approve the CCMHB funding of $256,700 as recommended for CU at Home Shelter Case Management Program, subject to the caveats as presented in this memorandum. Do I have a second?
Second.
With that, is there any discussion? Seeing none, can I get a roll call, please?
Jen Straub,
Yes.
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
John Paul Joachim.
Yes. All right, with that, we'll move on to CU Early, program CU Early, which is a new request for $77,184, which is 16% of total program revenue. The priority is thriving children, youth, and families. Required prior to contract is develop utilization targets for TBC, SC, and CSC. There's a special provisions below. And then the recommendation by staff was to fund at requested level and then commit $4,043 for DD. Is there any questions? All right, seeing none, is there a motion?
I move to approve CCMHB funding of $77,184 as recommended for CU Early, subject to the caveats as presented in this memorandum.
Do I have
I'll
a
second.
With that, is there any discussion? All right, seeing none, can I have a roll call, please?
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
John Paul Joachim.
Yes. With that, we'll move on to the next one, which is Champaign County Children's Advocacy Center, which is Children's Advocacy Program. The request is for $63,911, 20% of total program revenue. The priority is healing from interpersonal violence. The required prior to contract is identify utilization targets and PY24 priority. The recommendation by staff was to fund at the requested annual level and offer a 2-year term. Is there any questions? Seeing none, can I have a motion to approve?
I will move to approve CCMHB funding of $63,911 per year and offer a 2-year term as recommended for Champaign County Children's Advocacy Center, Children's Advocacy, subject to the caveats as presented in this memorandum.
I second.
With that, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie.
Yes.
Elaine Palencia, Jen Stroud,
Yes.
James Brandel,
Yes.
John Paul Yokim,
Yes. All right, moving along, the next one is Champaign County Christian Health Center, mental health care at CCMHC. The request is for $33,000, which is 100% of the total program revenue. Priority is innovative practices, closing gaps in access and care. And then required prior to contract is add utilization targets, PY24 priority, provide letter of engagement with CPA firm and PY23 audit or review. The recommendation by staff was to fund at the requested annual level and offer a 2-year term. Is there any questions? All right. Do I have a motion to approve?
I'll make a motion to approve the CCMHB funding of $33,000 per year and offer a 2-year term as recommended for Champaign County Christian Health Center mental health care at CCCHC, subject to the caveats as presented in this memorandum.
I'll second that motion.
With that, can I, or is any discussion? Seeing none, can I have a roll call, please?
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Stroud,
Yes.
James Brandel,
Yes.
Matt Hausman,
Yes.
John Paul Yokim,
Yes. All right, with that, we'll move on to Champaign County Healthcare Consumers, CHW Outreach and Benefit Enrollment. The request is for $91,054, which is 86% of total program revenue. Required prior to contract is select PY24 priority, revise forms as needed, adjust award amount, letter of engagement with CPA firm and for PY23 audit. Recommendation by staff was to fund $86,501, which is 95% of the request and offer a 2-year term. Is there any questions? Seeing none. I'll move to approve the CCMHB funding at $86,501 per year and offer a 2-year term as recommended for Champaign County Healthcare Consumers, CHW Outreach and Benefit Enrollment, subject to the caveats as presented in this memorandum. Do I have a second?
I'll second.
All right, with that, is there any discussion? No. Can I have a roll call, please?
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Stroud,
Yes.
James Brandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Yokim,
Yes. With that, we'll move on to Champaign County Healthcare Consumers. Justice involved CHW services and benefits. The request is for $94,892, 86% of total program revenue. The priority is behavioral health. Required prior to contract is select PY24 priority, revise forms, and adjusted award amount, letter of engagement with CPA firm for PY23 audit. The recommendation by staff is to fund at $90,147, also 95% of the request, and offer a 2-year term. Do I have a motion to approve?
I move to approve CCMHB funding of $90,147 per year and offer a 2-year term as recommended for Champaign County Healthcare Consumers, Justice Involved CHW Services and Benefits, subject to the caveats as presented in this memorandum.
I'll second.
Any discussion? Seeing none, can I have a roll call, please?
Joe Omosagie,
Yes.
Elaine Palencia,
Yes.
Jen Stroud,
Yes.
James Brandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
John Paul Yokim,
Yes. All right, with that, we'll move on to Community Service Center of Northern Champaign County, Resource Connection. The request is for $5,069, 26% of total program revenue. Priority is closing the gaps in access and care. Required part of contract is personnel. Form revisions, revised financial forms for lower award amount, and add utilization targets, provide letter of engagement with CPA firm for PY23 audit. Recommendation was to fund at PY23 level and offer a 2-year term. Do I have a motion to approve?
I'll move to approve the CCMHB funding of $68,609 per year and offer a 2-year term as recommended for Community Service Center of Northern Champaign County Resource Connection, subject to the caveats as presented in this memorandum.
I'll second.
All right, is there any discussion? Seeing none, can I have a roll call, please?
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Clay,
Yes.
Joe Almosagie,
Yes.
Elaine Palencia,
Yes.
John Paul Yoakim,
Yes. With that, we're going to move on to Crisis Nursery, Beyond Blue, Champaign County program. The request is for 100,000, 53% of total program revenue. Priority is thriving children, youth, and families. Required prior to contract is letter of engagement with CPA firm for PY23 audit. Revised forms for lower award amount. The recommendation is to fund at PY23 level and offer a 2-year term. Do I have a motion to approve?
Motion to approve CCMHB funding of $90,000 per year and offer a 2-year term as recommended for Crisis Nursery Beyond Blue, Champaign County, subject to the caveats as presented in this memorandum.
I'll second.
All right, with that, do I have any discussion? Seeing none, can I have a roll call, please?
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Holly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub, did I recall your name?
No, but yes.
Okay. John Paul Yoakim,
Yes. With that, we'll move on to DSC, Family Development. The request is for $656,174 dollars. 68% of total program revenue. Its priority is collaboration with CCDDB, Young Children and Families. Required part of contract is letter of engagement with the CPA firm for PY23 audit. And then recommendation is to fund with the MHB, IDD set aside and offer a 2-year term. I have a motion to approve.
Actually, quick question.
Oh, yes.
For the motion, do we have to put about that set aside? Okay, just want to make sure if that needs to be in there or not. In that case, I'll go ahead and move to approve CCMHB funding of $656,174 per year for a 2-year term as recommended for DSC Family Development, subject to the caveats as presented in this memorandum.
I'll
I'll
second.
With that, is there any discussion? Seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Holly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Palencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoakim,
Yes. All right, with that, we'll move on to the Don Moyer Boys and Girls Club programs. The first one is See You Change. Request for 100,000, 85% of total program revenue. Priority is thriving children, youth, and families. Required prior to contract is revised program narrative to include definitions of each category, possible changes to the contract to targets, lower CSE, revised financial forms to be consistent for a lower award amount, and a letter of engagement with the ZPA firm for PY23 audit. Recommendation was to fund at a lower amount than requested. Do I have a motion to approve?
I move to approve CCMHB funding of 75,000 as recommended for Don Moyer Boys and Girls Club. So you change subject to the caveats as presented in this memorandum.
I'll second that.
With that, is there any discussion? Seeing none, I'll move for a roll call, please.
Daphne Maurer,
Yes.
Holly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Palencia, Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Yoakim,
Yes. With that is, the next one is Don Moyer Boys and Girls Club, CUNC, which is a request for $132,322, 20% of total program revenue, and priority is SOC. And then, same required prior to contract things in the form, and then recommendation is to fund at PY23 levels. Do I have a motion to approve?
I make a motion to approve the CCMHB funding of $110,000 as recommended for Don Moyer Boys and Girls Club, CUNC, subject to the caveats as presented in this memorandum.
I'll second.
All right, any discussion? Seeing none, can I have a roll call, please?
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia.
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Yoking.
Yes. With that, we'll move on to Don Moyer Boys and Girls Club Community Coalition Youth Summer Initiative or initiatives. The request is for $107,000, which is 100% of total program revenue. Priorities, thriving children, youth, and families. The recommendation by staff was to fund at lower amount than requested. Do I have a motion to approve?
I move to approve CCMHB funding of $90,000 as recommended for Don Moyer Boys and Girls Club Community Coalition Summer Youth Initiatives, subject to the caveats as presented in this memorandum.
Second.
All right, with that, is there any discussion? Excuse me, seeing none, can I have a roll call, please?
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie.
Yes.
John Paul Yoking.
Yes. The next is Don Moyer Boys and Girls Club Youth and Family Services. This request is for $160,000, which is 100% of total program revenue. And the recommendation was to fund at a lower amount than requested, but we will, the new recommendation is to fund at the full amount of $160,000, correct? Yeah. So with that, I will move to approve CCMHB funding of $160,000 as recommended for Don Moyer Boys and Girls Club Youth and Family Services, subject to the caveats as presented in the memorandum. Do I have a second?
I'll second that.
And is there any discussion? All right, seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia, Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoking.
Yes. All right, with that, we'll move on to the ECIRMAC, Family Support and Strengthening Program requests of $71,300, which is 6% of total program revenue. Priority is thriving children, youth, and families. Prior to contract, they have to settle questions for PY22 audit, submit a letter of engagement with a CPA firm for PY23 audit with anticipated completion date on or before the deadline of December 31st, 2023. Revise the program narrative plan to align with the utilization target or categories with definitions, and track unduplicated clients without losing detail on number of activities and attendings on each, and revise forms, financial forms. The recommendation by staff was to fund at PY23 level and offer a 2-year term. Do I have a motion to approve?
Motion to approve CCMHB funding of $62,000 per year for a 2-year term as recommended for ECIRMAC, the Refugee Center, Family Support and Strengthening, subject to the caveats as presented in this memorandum.
I'll second.
All right, is there any discussion? Seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoking.
Yes. With that, we will move on to Family Service of Champaign County counseling program request for $30,000, which is 40.3% of total program revenue. Priority is closing the gaps in access and care. Required prior to contract is a letter of engagement with CPA firm for PY23 audit. The recommendation is to fund at requested level and offer a 2-year term. We have a motion to approve.
I move to approve the CCMHB funding of $30,000 per year and offer a 2-year term as recommended for Family Service of Champaign County Counseling, subject to the caveats as presented in this memorandum.
I'll second.
Oh, sorry. So Jane seconded, and, do I have any discussion? No, with that, can I have a roll call, please?
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
John Paul Joachim,
Yes. With that, we'll move on to Family Service of Champaign County Disability Benefits for the Family. This is a new request for $72,619, 100% of total program revenue. Priority is closing the gap in access and care. Required prior to contract is correct any errors in personnel form, prorate the contract maximum to account for vacancies and amend increase and as vacancies are filled, letter of engagement with a CPA firm for PY23 audit. The recommendation was not to fund due to affordability. The agency is encouraged to submit the program proposal next year. And I'll just say that this was an excellent program and very well done. And hopefully we have more funding next year to fund this because it's definitely desperately needed. So with that, sadly, I will move to deny CCMHB funding as recommended for Family Service of Champaign County Disability Benefits for the Family, subject to the caveats as presented. Or I don't need to put that last part. Yeah. Do I have a second?
I'll second.
All right. Is there any discussion?
I just want to add that I am very sad that this program is not going to be able to be funded this year, and I definitely want to encourage the organization to resubmit next year.
All right. With that, can I have a roll call, please?
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Joachim.
Yes. With that, we'll move on to Family Service of Champaign County Self-Help Center. Request is for $28,930, 92% of total program revenue. And then the recommendation by staff for this was to fund at previous levels with PY24, a non-conference year. So there will be two different fundings for PY24 and PY25. With that, I'll move to approve the CCMHB funding of $28,430 for PY24 and $28,930 for PY25, and offer a 2-year term as recommended for Family Service of Champaign County Self-Help Center, subject to the caveats as presented in this memorandum. Do I have a second?
I'll second.
Yeah. And then with that, is there any discussion? Can I have a roll call, please?
Joe Omosage,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
John Paul Joachim.
Yes. With that, we'll move on to Family Service of Champaign County Senior Counseling and Advocacy for a request of $178,386, 32.7% of total program revenue. The recommendation by staff was to fund it as requested and offer a 2-year term. Do I have a motion to approve?
I'll move to approve CCMHB funding of $178,386 per year and to offer a 2-year term as recommended for Family Service of Champaign County Senior Counseling and Advocacy, subject to the caveats as presented in this memorandum.
I'll second that.
All right. With that, is there any discussion? Seeing none, can I have a roll call, please?
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Valencia, John Paul Joachim.
Yes. With that, we'll move on to Immigrant Services of CU, Immigrant Mental Health Program. A new request, this is a new request for $119,705, which is 77% of total program revenue. Priorities closing the gaps in access and care required prior to contract is complete, transition to accrual accounting, revised financial forms. And then the recommendation was to fund at an adjusted amount of $90,000. I will move to approve CCMHB funding of $90,000 as recommended for immigrant services, CU immigrant mental health program, subject to the caveats as presented in the memorandum. Do I have a second?
I will second.
With that, is there any discussion? I'll just say that, I'm very happy that we're able to fund this program this year. All right, with that, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Palencia,
Yes.
Jim Stroud,
Yes.
Jane Sprandel,
Yes.
John Paul Yuki.
Yes. With that, we'll move on to the Mahomet Area Youth Club, Bulldogs Learning and Succeeding Together program, which is a request for $12,000, which is 86% of total program revenue. Required prior to contract to select PY24 priority, revise utilization measures, settle questions from PY22 audit, submit a letter of engagement with a firm for PY23 audit with anticipated completion date on or before December 31st, 2023. The recommendation by staff was to deny funding at this time. Are there any questions? All right, with that, do I have a motion to deny?
Yeah, I'll move to deny CCMHB funding to Mahomet Area Youth Club, Bulldogs Learning and Succeeding Together as recommended.
Do I have a second?
I will second that.
All right, any discussion?
Did we ever hear back about the $7 or $71 million?
We did. We actually heard back during the study session. It was quite late. It was 71,000, not 71 million. So I think you called it. And we have talked to them. They haven't really responded to the biggest question is follow up on the audit. We're not done with that. So.
Any other comments or questions? All right, with that, can I have a roll call, please?
Molly McClay,
Yes.
Joe Omosage,
Yes.
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Joachim,
Yes. So motion to deny passes. We'll move on to Mahomet Area Youth Club, MAYC Members Matter. The request is for $27,405, which is 16% of total program revenue. And then the recommendation by staff also was to deny funding at this time. I will move to deny CCMHB funding as recommended for Mahomet Youth Area Club, Macy Members Matter. Do I have a second?
I'll second that.
All right. Is there any discussion? The one thing I would just say is I do hope the agency does apply next year, and hopefully we can get the questions answered and hopefully continue funding this program for the kids in the area. With that, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosage,
Yes.
Elaine Palencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
John Paul Joachim.
Yes. Motion to deny passes. Next program is the Promise Healthcare Mental Health Services, which is a request for $352,035, 19.8% of total program revenue. The priority is closing the gap in access and care. Required prior to contract is revised financial forms and program plan if impacted by lower award amount. And then the recommendation by staff was to fund at a level lower than requested and offer a 2-year term. So the requested, the lower amount recommended was $330,000. I have a motion to approve.
I'll make a motion to approve the CCMHB funding of $330,000 per year for a 2-year term as recommended for Promise Healthcare Mental Health Services, subject to the caveats as presented in this memorandum.
A second the motion.
With that, can I have, all right, any discussion? With that, can I have a roll call, please?
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia, Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Yuki.
Yes. All right, with that, we'll move on to Promise Healthcare PHC Wellness, request for $107,078, 30% of total program revenue. Required product contract is to revise errors, if any, in program or financial forms. The recommendation is to fund at the requested level and offer a 2-year term. I'll move to approve the CCMHB funding of $107,078 per year for a 2-year term as recommended for Promise Healthcare PHC Wellness, subject to the caveats as presented in the memorandum.
I second the motion.
Any discussion? Seeing none, can I have a roll call, please?
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia.
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Yuki.
Yes. With that, we're going to go on to RACE's sexual trauma therapy services. It's a new request for $149,284, 30% of total program revenue. Required project contract is add specific utilization targets, revise financial forms to adjust award amount. The recommendation by staff was to fund at a lower level than requested, which is $140,000, and offer a 2-year term. Do I have a motion to approve?
I move to approve CCMHB funding of $140,000 per year and offer a 2-year term as recommended for rape advocacy counseling and education services, sexual trauma therapy services, subject to the caveats as presented in this memorandum.
Second.
All right. With that, is there any discussion? Yeah, you can make a comment.
I think in April, when the agency answered questions about this application, they let you know that they had applied for funding from United Way, who will make decisions tomorrow. So of course you can't see their decisions, but they can see yours. So I'm gonna, as soon as we're done, I'm gonna send this to them so that they can see what, what you funded with RACES and any others that they co-funded in case that helps them tomorrow. So anyway, just thought I'd say that.
Any other discussion? All right. I mean, I will just say that this is a vital service in the community and we cannot lose this. And I am very proud that the Mental Health Board has the funding to support this. So I'm glad that we're able to do this. With that, can I have a roll call, please?
Joe Almosagie,
Yes.
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 Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
John Paul Yuki.
Yes. With that, we'll move on to RACE's sexual violence prevention education for $82,996, which is 30% of total program revenue. And then the recommendation was to fund at a lower level than requested, which is $75,000, and offer a 2-year term. I'll move to approve the CCMHB funding of $75,000 per year and offer a 2-year term as recommended for rape advocacy counseling and education services, sexual violence prevention education, subject to the caveats as presented in the this memorandum.
Second.
Is there any discussion? Seeing none, can I have a roll call, please?
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
John Paul Yuki.
Yes. With that, we'll move on to Rosecrans Central Illinois benefits case management. So this request is for $80,595, which is 14% of total program revenue. The recommendation was to fund as requested. Do I have a motion to approve?
Motion to approve CCMHB funding of $80,595 as recommended for Rosecrans Central Illinois benefits case management, subject to the caveats as presented in this memorandum.
I'll second the motion.
With that, any discussion? Seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia.
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoakim.
Yes. All right, with that, we will move on to Rosecrans Child and Family Services, a request for $83,500, 72% of total program revenue. Recommendation is to fund at a lower level than requested. Do I have a motion to approve? All right, I'll move to approve the CCMHB funding of $73,500 as recommended for Rosecrans Central Illinois Child and Family Services, subject to the caveats as presented in the memorandum. Do I have a
I'll second.
All right, with that, is there any discussion? Seeing none, can I have a roll call, please?
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Yoakim.
Yes. Next is Rosecrans Central Illinois Criminal Justice PSC, a request of $330,000, 69% of total program revenue. The recommendation is to fund at PY23 levels, which is $320,000. Do I have a motion to approve?
I make a motion to approve the CCMHB funding of $320,000 as recommended for Rosecrans Central Illinois Criminal Justice PSC, subject to the caveats as presented in this memorandum.
I'll
Second.
second.
Okay.
With that, is there any discussion? Seeing none, can I have a roll call, please?
Jen Straub,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia.
Yes.
John Paul Yoakim.
Yes. With that, we'll move on to Rosecrans Central Illinois Crisis Co-Response Team for a request of $207,948, 43% of total program revenue. The recommendation is to fund as requested. Do I have a motion to approve?
I'll move to approve the CCMHB funding of $207,948. It's recommended for Rosecrans Central Illinois Crisis Co-Response Team, subject to the caveats as presented in this memorandum.
I'll second.
All right, with that, is there any discussion? Seeing none, can I have a roll call, please?
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia.
Yes.
Jen Straub,
Yes.
John Paul Yoakim.
Yes. With that, we'll move on to Rosecrans Central Illinois Recovery Home for $100,000, which is 24% of total program revenue. The recommendation is to fund at requested level. Do I have a motion to approve?
I make a motion to approve CCMHB funding of $100,000 as recommended for Rosecrans Central Illinois Recovery Home, subject to the caveats as presented in this memorandum.
Second.
Any discussion? Seeing none, a roll call, please.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia.
Yes.
Jen Straub,
Yes.
Jane Sprandel,
Yes.
John Paul Yoakim.
Yes. With that, we'll move on to Rosecrans Central Illinois Specialty Courts, which was a request for $178,000, which is 99.6% of total program revenue. The recommendation is to fund as requested. So I will move to approve CCMHB funding of $178,000 as recommended for Rosecrans Central Illinois Specialty Courts, subject to the caveats as presented in this memorandum.
Second.
Any discussion? So the one thing, just to clarify, we are adjusting this level from the previous recommendation of funding at the PY23 level and instead funding at the full requested level. Just so we're clear. All right, with that, can I have a roll call, please?
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie.
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
John Paul Yoking.
Yes. With that, we'll move on to Terrapin Station Sober Living NFP Recovery Home. The request is for $79,677, 82% of total program revenue. The recommendation is to fund as requested. Do I have a motion to approve?
Motion to approve CCMHB funding of $79,677 as recommended for Terrapin Station Sober Living NFP Recovery Home, subject to the caveats as presented in this memorandum.
Second.
With that, is there any discussion? Seeing none, can I have a roll call, please?
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly,
Yes.
Joe Almosagie.
Yes.
John Paul Yoking.
Yes. With that, we'll move on to the Up Centers, Up Center of Champaign County Children, Youth and Families Program, request for $190,056, 58% of total program revenue. The recommendation is to fund as requested. I'll move to approve the CCMHB funding of $190,056 as recommended for the Up Center of Champaign County Children, Youth and Families Program, subject to the caveats as presented in this memorandum.
Second.
With that, is there any discussion? I'm seeing none. A roll call, please.
Yes.
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
John Paul Yoking.
Yes. Now comes the Well Experience, which is the Well Family Care Program. The request is for $256,656, 51% of total program revenue. When adjusted by error in expense form, the total is $220,656. The recommendation was to defer a decision until approved PY22 audit is submitted and reviewed and any issues resolved, and in the event of increase in CCMHB revenue projection for PY24.
Yeah, I'll move to defer a decision until additional information and funds are available on CCMHB funding as recommended for the Well Experienced Well Family Care Program.
I'll second the motion.
All right, with that, is there any discussion? All right, seeing none, can I have a roll call, please?
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
John Paul Yoking.
Yes, so the motion to defer has been approved. We will move on to Urbana Neighborhood Connection Center, Community Study Center. The request is for $25,500, 15% of total program revenue. The recommendation is also to defer a decision until approved PY22 audit is submitted and reviewed and any issues resolved, and in the event of increased CCMHB revenue projections for PY24. So I will move to defer a decision until additional information and funds are available on CCMHB funding as recommended for Urbana Neighborhood Connection Center, Community Study Center. Do I have a second?
I'll second the motion.
Any discussion? All right, with that, can I have a roll call, please?
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
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 Daphne Maurer,
Yes.
John Paul Yoking.
Yes. All right, motion to defer has been approved. We'll move on to the Win Recovery Community Support Reentry houses. The request is for $123,198, 44% of total program revenue. The recommendation also is to defer a decision until approved PY22 audit is submitted and reviewed and any issues resolved, and in the event of increased MHB revenue projection for PY24. Do I have a motion to defer?
I'll move to defer a decision until additional information and funds are available on CCMHB funding of $123,198 is recommended for wind recovery. Community support reentry homes, subject to caveats as presented in the memorandum.
Second.
All right, with that, is there any discussion?
I just wanted to say for this and the last two applications that is, I find it personally difficult to defer, and I hope that we are able to get additional information and have additional funds available later to be able to reevaluate these applications.
I agree. Is there any other comments or questions or discussion? All right.
That was well said, and I agree as well. Thank you.
With that, we'll move on to roll call, please.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie.
Yes.
Elaine, did I say your name already?
Oh, but yes, again.
John Paul Yoakim.
Yes. So a motion to defer has been approved. With that,
We have a few more.
oh,
They're a little different nature, but
Yeah.
so these are, on the screen, I have the adjusted totals incorporating the additional. Sorry, I have adjusted totals of the amount recommended and the amounts denied, and then the difference, which is a little bit smaller than it was, but still the most competitive in years and years and years, maybe ever. And then also so the green highlights are on the changes. Shoot, lost the cursor there. So right now there's, you're setting aside about 43,000 and hoping for some more for like an increased revenue projection. So the rest of this money is coming out of this IDD Special Initiatives Fund, which is there. It's money that's in fund balance and will be transferred, and that's from the sale of the homes. So these are also both approved. The DDB already approved both of these, so it's now, if the Mental Health Board also agrees, then we'll enter into contracts for these as well.
all right. With that, the next program is the DSC Individual and Family Support, which is a request of $250,000, which is 99.5% of total program revenue. The recommendation was to fund through the IDD Special Initiatives Fund. And then because the fund is under joint authority, approval by both boards is required. And then they approved it on the 17th. So do I have a motion to approve?
Motion to approve I/DD Special Initiatives funding of $250,000 for DSC Individual and Family Support, subject to the caveats as presented in this memorandum.
I second.
Any discussion? No. With that, can I have a roll call, please?
Molly McClay,
Yes.
Joe Omosagie.
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
John Paul Yoakim.
Yes. With that, we'll move on to persons assuming control of their environment, which is PACE, consumer control and personal support. The request is for $36,000, which is 94% of total program revenue. Recommendation also is to fund through IDD Special Initiatives Fund because, again, same thing. And the CCDDB board approved the motion last week. I'll move to approve the IDD Special Initiatives funding of $36,000 for persons assuming control of their environment, PACE, consumer control and personal support, subject to the caveats as presented in the memorandum.
I second.
All right. With that, is there any discussion? Seeing none, can I have a roll call, please?
Jane Sprandal,
Yes.
Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Omosagie,
Yes.
Elaine Valencia,
Yes.
Jen Straub,
Yes.
John Paul Yoakim.
Yes. With that, I've finished the approvals for now. I know, a very difficult year. Happy we were able to fund so many, but sad that there is a lot that still needs to be funded. So with that, we'll move on to agency requests for consideration, which is the Well Experience, requesting a waiver on cancellation of contract. I'll give people time to read the memo, and Lynn, you can.
It's a really nice letter, but this is about the automatic cancellation of contracts, which would occur 3 months after the deadline is missed, the original deadline is missed, but this board approved an additional couple of months up to June 1st. And so the others look like they're going to have audits finished by June 1st, which is just a few days. But Ms. Cockrell has written a letter asking for additional time. And she's also on the call if you have any questions for her, but the letter is quite thorough. This would just keep us from canceling the contract. That's all. Yeah.
Just to clarify, we're currently suspended payments, right? And that's what, okay.
That's what I was going to ask too. So yeah. Yeah, I mean, I don't have any problem extending this as long as the audit is getting done. Obviously, the letter is pretty explanatory. I don't have any objections. Does anyone have any questions or any comments?
Are we sure June 26th? I mean, that seems like a very specific date, as opposed to like July 1st or something. I don't know if she's on or.
I agree. I would go for July 1st because that's the end of, June 30th is the end of the contract. So we would be just holding payments. Yeah, but she's on. So.
Good evening, everyone. Thank you so much. The June 26th date, honestly, when speaking with the accountant and basically just trying to figure out if it was possible to get this done before the end of the fiscal year, she was telling me that, you know, with me and Mary working on getting everything taken care of and making sure that everything is cleared and all the double transactions are cleared so that we can get it done. I pressed to her that I didn't know if you all would allow it to roll over into the next fiscal year, which would be July 1. And that was the only reason for looking into maybe getting it done a week before, and so that we could have it done and submitted. That was the only reason for suggesting before the 1st. I'm very upset by this, and it's quite embarrassing for me. As I've talked to Lynn, there are several things we just did not know were happening, and we thought that having the company we were working with working on our books was a good idea, but through Mary, of whom you all have allowed us to have, and she's amazing, and also through the accountant, we have found, and QuickBooks, we found that the transactions that have been the most damaging to our books and have the most disparities came from the accountant firm we were working with previously. So we have disengaged with them and are working to get everything repaired so that this won't be an issue.
I'm sorry. Thank you for that. With that, we'll need a motion, correct? All right. Yeah. So
I apologize. I didn't write one for you.
Yeah. So I will move to approve a request for a waiver of the cancellation of the Well Experiences contract and extend the date for the audit deadline to July 1st, 2023.
Second.
All right. Is there any discussion? With that, can I have a roll call, please?
Who seconded?
Jen Straub did.
Oh, okay. Matt Hausman,
Yes.
Daphne Maurer,
Yes.
Molly McClay,
Yes.
Joe Almosagie,
Yes.
Elaine Valencia,
Yes.
Jen Stroud,
Yes.
Jane Sprandel,
Yes.
John Paul Yogi.
Yes. With that, we'll move on to old business, which is the agency PY 23 third quarter service reports from pages 48 to 92.
We just started doing this. I think Leon, did we do this the first time with second quarter reports?
That's correct.
I mean, I think there's a lot of interesting information in here. I don't know if it's helpful to you all to have it, but.
I really enjoyed the narratives. I thought that was really helpful just to kind of envision what each of these organizations is doing with our funds.
Any questions or comments about that? All right. Yeah, I agree. I like it because it's informative and it just gives us an idea of obstacles they're facing and how they're succeeding, and what they're doing well, what struggles agencies are having. And it's nice because then if there is struggles that are consistent across agencies, it kind of gives us an idea as a board what's going on. Obviously, you guys know behind the scenes of the staff, but as a board, we're it's a nice update for us. With that, we'll move on to the 211 first quarter 2023 report.
Look how pretty it is in the online version.
It was hard to tell on the graphs in black and white what color was what. Like the COVID calls and non-COVID ones.
We're still working on getting a color printer someday.
Yeah, too expensive, not. Yeah,
Okay.
it's okay. We can let, yeah. And the one thing I always notice is just the majority of calls are always housing needs. So it looks like I couldn't see because it cut off, but the utility assistance I couldn't tell if it was double digits or single digits. But obviously, whenever it gets warm again, power companies can start cutting off power because it's not a necessity anymore. Yeah. So if it's not too hot, not too cold, they can cut off the power. And I always tell families, because we always get calls in pediatrics for a letter of medical necessity for power and water. And we always tell them that, it doesn't cancel the bill. It just makes it so you don't have to pay it. So you can at the time that you need to, but the bill still accrues. And so we always have them refer to our social worker to give them resources in the community. So I'm glad, 211 is there to provide the utility assistance and resources for that. Yeah, and I'm glad to see that still there's a good amount of social service agencies that provide referrals to this 211 service. Yeah, the only other thing was on page 111, there was the call center density. It seemed like our density is hard to tell based on the color, but it seemed like we were somewhere on the higher end of how many calls we get. Not as bad as like maybe McLean County and other some other counties, but somewhere in 1 in 50 to 100 people. At least the top category would receive at least one call for every 50 inhabitants that year. So our county is about 50 to 100. For every one person for every 50 to 100 people will call needing services. Is that right? All right. So it seems like it's high. So there's a lot of need. There's a lot of need in their community. That's the second highest on the legend. If I'm reading correctly, I can't tell the shades of the gray there.
Now that you say that, it does concern me a little bit because there are some counties, especially in Southern Illinois, that you would think there'd be higher need. And I'd be wondering if they're really getting much outreach there, that people know about it there.
Then maybe there's a lack of resources down there too.
Oh, yeah.
And so then they don't call because they're like, well,
Yeah.
no one, there's nothing to help, no one to help me here.
Sure.
So places with need, but that have resources probably have more calls. So there's probably two confounding variables there. One is need and two is availability of resources. All right, any other questions, comments? All right, with that, we'll move on to the schedule on pages 114.
The best part.
Right. So our next meeting is June 21st. Do you have any comments about that?
I'm so nervous that I'm going to try to bring you memos every month with like, all right, we got $20,000 more. Let's spend, so you can help me restrain myself to. So what you'll do in June that's important is election of officers. So it might be, time to start thinking about whether John Paul Joachim wants to continue as president or Joe Omasage as vice president. And if other people are interested in these offices, like we could have some very spicy election campaigns for the next month, right? So, and it is important that you complete it before July 1st because the terms start July 1st. This revised Community Mental Health Act that's about to become law has some very confusing language about when you should hold your elections for the July 1st start. It could get weird next year, so I'm enjoying the rational approach of doing it in June. So while we still can. I do have dates for next year also. And so the next time you see the schedule, it'll have lots and lots more dates into the future. We also have, thank you, Leon and Stephanie, and also Kim Bowdry, who's on here, helping me figure out like a slightly different allocation process timeline. So that'll be also in next month's packet. And it is a longer application period. It starts before Christmas and ends on a Monday or Tuesday, as we talked about. So just that might be easier if there are problems on the last day of the application. It might be easier for us to deal with those problems as a team. So you'll get to, that's surprise for June. Okay, that's it.
All right. With that, we'll go on to agency input. So if there's any agencies that would like to make any comments, limit your comments to 5 minutes. Seeing none, we'll move on to the Champaign County Developmental Disabilities Board input.
No news since last week.
Excellent.
Oh, because they met, I guess we didn't talk about that at your study session. They met last Wednesday, the same day as your study session, and you can see what they approved that you also approved. That was the main thing they did. It was so long ago, I can't remember what else happened at that meeting. Maybe that's good. Okay.
All right, with that, we'll move on to staff reports.
There's some fun stuff.
I saw the Disability Expo is Saturday, October 28th. I know we had talked about that before. Just a reminder for everybody.
Yeah, there's some.
Luckily, that should be in the morning, so it won't affect Halloween and people trick or treating.
I had so much fun last year at the expo. I wouldn't mind if it was Halloween. So
Well,
mean, if
I
people
think
wanna
we
come with
want to
costumes.
encourage some trick or treating at the mall. So yes, there was some discussion about that.
I think we will have a brief presentation for you next month on what's going on with the expo so far. Okay.
I mean, if there's candy involved, I'll volunteer. Let's do it. All right.
Did you see the other post? There's art. There's
Oh,
other art
the
in there.
air, right?
Where is it? There.
Yep.
So, and then like. Just in time for last weekend's art show, which was really fun. Sorry.
All right. And then, I guess the only thing was just all this fund reporting. There was a lot of information on there. Was there any changes to this?
Well, this is a formatted report that Chris found in the Munis system. He had to play with it to make it accessible. It is accessible. We're trying to make as much of the board packet documents accessible as possible. And this one, he did it. And it wasn't easy. But so you get information on all three funds, because since there is a relationship between the three funds, I think that's fair. But they went up to, these were as of April, and then he and I had some information about May as well that I used for the budget that you'll see next month. But yeah, do you have a question? It is a new format. Yeah.
All right. With that, are there any board-to-board reports?
As usual, I went to the Community Coalition meeting, and on May the 10th, when the meeting was, the shootings in Champaign were down 52%, but since then it's gone up again. There were some, the new Amy Brown, the new Don Moyers, had talked about a STEAM program that they have there that's getting, more articulated, I guess you would say. And the unit 116, the school system, Will Urbana, has now this freedom school that it's preventive. It's not like the Ready school. And they're going to serve 50 middle and high school students after school and in the summer, and partner with the neighborhood connections. So that looks like a nice, system of care, collaboration there. And then they were addressing fentanyl again. So it's getting to be an increasing problem. But anyway, and other stuff, but that was kind of the highlights.
And then this is Daphne Maurer, and I have been having problems being able to attend the Rosecrans board meetings as our liaison, and so due to my work schedule, and I'm just wondering if there is anyone else on the board that would like to take that role that might be more able to successfully complete that task.
All right. With that, we'll move on to, go ahead.
I just wanted to say in relation to Lynn's question about opioid settlement money coming into our county, Chair Patterson is forming call it a task force. I think he called it a task force or a committee regarding opioid settlement money and just recommendations for how it should be spent within our county. I've asked to be on that because of my extra load of free time. So hopefully we will have some input.
With that, we'll move on. I guess that's part of board announcements, I guess. So yeah, any other board announcements? All right. All right. With that, I will move to adjourn. See you guys next month. Thank you for all your work.